It's not uncommon for families to live in multi-generational households. In fact, more than 20% of the United States population lives with multiple generations under one roof. That's according to the Pew Research Center. The COVID-19 pandemic has brought on many challenges in our everyday life, and in some instances, it's the places we live in. Welcome to this edition of House Call. I'm Jessica Salazar with Overland Park Regional Medical Center, a part of HCA Midwest Health. Today we're chatting with Dr. Erin Lockard, a board-certified internal medicine and geriatric medicine physician with Quivira Internal Medicine. Welcome, Dr. Lockard.
Hi, thank you so much for having me.
Thanks for joining us today. I'm sure you're seeing multi-generational families in your practice. How can families protect themselves in this time?
I am. So to start with, caution is key. Following the CDC guidelines for general precautions like wearing a mask, covering your nose and mouth at all times in public, social distancing, frequent hand washing. Those guidelines should be followed at all times. And if you live with a vulnerable person, all members of the family, all members of the household should really behave as though they're vulnerable. In the home, you want to avoid contact with anyone who is sick. You want to clean and disinfect surfaces often, as well as cleaning and disinfecting frequently handled items like your phone and TV remotes.
Yeah.
Yeah. You want to, whenever you can, open windows and improve ventilation. Go outside when you can to do family activities, and continuously monitor your own health.
I live in a multi-generational household. I'm the caregiver for my 92-year-old grandmother, and both my parents are in their mid-60s, and both my kids are around them every day. What if one of my sons brings home a virus? How do I make sure that I'm keeping my parents and my grandparents safe? And I'm sure there's other people who are in the same situation that I am, caring for a multi-generational household. How do we keep those older relatives safe in our home?
Yeah, so it's interesting you say there are other people in that situation. As of 2020, 24% of Americans do informal caregiving for more than one person in multiple generations. So that's a quarter of households. So if you have a child that comes home having been exposed or testing positive, step one is you really don't want those older, vulnerable people providing direct care for children. The children, if they are under the care of a vulnerable person, should not be kids that are going out into the public and being exposed potentially to COVID. So other things to keep in mind if you have a positive kid, you want to keep as much space as possible between the sick or positive person and the vulnerable person. You want to have the sick or positive testing person wearing a mask at all times when in common spaces, especially when they're around at-risk persons. You want to make sure the sick or positive person knows to cover their mouth when they cough, sneeze. You want them to avoid frequently touching their eyes and mouth. You want them to engage in frequent hand washing. If they are sharing bedrooms, you want to keep them sleeping as far apart as possible. If they're sharing bathrooms, you want to regularly clean and disinfect the bathroom after they're used by the positive or sick person. And avoid sharing personal items with the sick or positive person, like phones, dishes, bedding, towels, toys. And if that must be done, clean and disinfect those items. And if you have to share, for example, a bedroom, you want to keep the airflow in that bedroom as mobile as possible. So keep your fans on. If it's okay to open windows, separate beds. If people have to sleep in the same bed, they may consider sleeping head to toe in a
Okay.
staggered
Hmm.
position. If it's possible to create kind of a boundary between people, like maybe put a curtain up between the sick person and other people, that would be great. When you wash and dry their linens, do that frequently and wear gloves while you're doing that.
Now, do you have tips
Um,
on taking care of a sick family member if they do have COVID symptoms?
yeah, so you want to make sure the sick person is staying hydrated, getting plenty of rest. You can use over-the-counter medications for symptoms. You want them to frequently wash their hands. Um, and no, most of the time they will have symptoms for a few days and usually improve within a week. You do want to keep an eye out for emergency signs or symptoms like trouble breathing, chest pain or pressure, um, bluing of the lips or face, uh, any mental status changes like confusion or lethargy, and have a low threshold to call 911 if you detect emergency signs or symptoms. Um, Also, have your doctor's numbers on hand in case you have any questions.
What is your advice for going outside of the household? Should only one of us be going out for groceries, pharmacy runs, errands, etc.?
So that is an ideal if you can do that, and you want to minimize trips. Um, I try to go to the grocery store at 6 in the morning when nobody's there. So going at non-peak times is good. I would avoid going to places that don't follow mask mandates. So try to be wise about the places you're going. And I recommend investigating delivery options like grocery delivery, food delivery, Meals on Wheels. Um, there are some options to help you minimize trips
Mhm.
out.
Now, should we be keeping up with doctor appointment visits? My 92-year-old grandma sees several specialists, and I still want her to get her health care safely. Um, how do we do that? Should we ask for telemedicine appointments? Should we take her in? I'm sure this is a question that you get a lot from some of your patients.
Yeah, so I would always ask if telehealth is an option, and for conditions specific to the individual, that may not be the case, but at least ask. And at this point in the pandemic, most offices have pretty well established protocols to help keep patients safe. Um, like we have our waiting room, the chairs are spaced, people are at all times masked, and then we're routinely wiping down and cleaning rooms. So we're really trying to minimize any risk for our patients.
What is your advice for younger people who are taking care of an older generation regarding mental health? What are ways for them to safely get out of the house or to help calm any stress and anxiety that they may have?
So one piece of advice I've read that I like is turn each worry into a plan. The way I like to do that is write things down. I find writing very therapeutic, and then you can kind of establish on paper what your worries are, and that puts you in a better place to come up with strategies to address any concerns. Um, Keep an inventory of your resources. So what I mean by that are um, keep an inventory of the over-the-counter medications you have in your home, food and supplies, medications, and then resources like extra help and options if you do get into a state where you need, let's say, a formal caregiver to step in and keep an eye on your 92-year-old loved one. know some resources for getting caregivers, be they family or hired caregivers. Take time for yourself and make sure you get good 7 to 9 hours of sleep when possible, get regular exercise, get outdoors, and limit your news and social media because they can be stressors. And draw on your strengths. So if you're somebody that's good at being organized in Excel spreadsheets, use that to your advantage. Yeah, and caregiving, I think, is becoming increasingly recognized as something that we as physicians really need to be paying attention to. Caregivers are at increased risk for not attending to their own health, not attending to their own mental health. They're at increased risk for anxiety, depression, substance use. So we really need to, as a profession, kind of address and embrace these roles that people are playing so that we can help support people caring for our patients and as our patients. So
It's an important topic.
if you're caring for an older person in your home, there are a few things you want to make sure you have available and kind of planned out. Number one is you need to find out if you are the legal caregiver. And if there are documents stating that. So the documents I'm referring to are an advance directive designating a healthcare proxy and a living will. Make sure that the people who need that information have that information. And if you are not the legal healthcare proxy, just make sure you have that contact information readily available in case it's needed. And know your loved one's wishes in case they do suddenly become ill. Have those conversations and just be prepared. And then other things to have on hand in the case of an emergency, things like medical contacts, current medication list, a diagnosis list if you have one. Have on hand your family and friend network that you can reach out to for emergencies. Have some available community resources. And then have, like I said before, an inventory of your supplies at home. And there are several organizations that have good information for caregivers. Those organizations are the AARP has a caregiving resource on their website, the National Alliance for Caregiving. There's an online source called Next Avenue that has a caregiving site, the Alzheimer's Association, and then where you live, your county will have an area agency for aging with local resources. And have a plan to stay connected and keep your loved one connected to other family members, to friends, be it through Zoom or FaceTime, because maintaining as much connection is another great way to prevent both, mental health issues and caregiver burnout.
That's great advice. It's funny, my 92-year-old grandma is learning Zoom. I think it's a fun way to keep her connected with family, locally and that we have across the country. So
Yeah.
it's nice to see her embracing the technology.
Yeah. My aunt who's older is really into her Zoom yoga classes. So that's really great. Makes me happy that she has that.
Is there anything we can do to boost our immune system? We hear a lot about vitamin C, elderberry. Is there anything that we can be giving the people that we take care of to help them stay healthy?
So as of now, there's no evidence to support use of any specific vitamins for prevention. I would say, in general, what we do recommend is a varied and nutritious diet, and routine physical activity and good sleep. All those things will help support a healthy immune system and managing stress.
Thank you, Dr. Lockard, for joining us today. If you or a loved one are looking for a primary care physician, please visit oprmc.com and click on Find a Doctor.